The Board of Health has put a spotlight on gun violence and strategies to end gun violence in King County. A gun violence prevention summit was held in White Center over the last 2 evenings. We heard directly from many people who have had personal experiences of gun violence and who are doing hard work to make sure that we can stop the violence from affecting other people. The board has had a long history of working to improve the health of people in King County with a focus on gun violence as being part of that work. Last year, the board passed legislation targeted specifically at requiring the posting of health warning signs at gun retail stores and firing range that includes contact information for crisis connections. I'd like to thank Board Member Joe McDermott in particular for spearheading what we've been doing this week. I'd like to have him just give a few remarks, and then we'll turn to Miranda Leskinen on our staff, who will give an overview as well, and then we have a few panelists here. Thank you, Board Member McDermott.
Thank you, Madam Chair, and thank you for your leadership in making sure that this was a event sponsored by the Board of Health. We've had a robust conversation the last 2 nights, and I'm eager to have a conversation here with the entire board and those who've joined us. And I know many who couldn't join us today were also invited and may be watching on KCTV as well. I could go into a lot now, but I want the panelists to be able to reflect and report on what we've done over the last 2 nights. Let me briefly thank not only you, but Councilmember Bernie and Councilmember Marks and Dr. Daniel and Mr. DeCastro for joining us as board members over the last 2 nights. And in addition to that, other elected officials who joined us included Sheriff Mitzi Johanknick, Senator David Frocht, and Mayor Jimmy Mata of Berrien, and Councilmember Austin Bell, also of Berrien, in addition to Director Hayes, Dr. Dushin, and Ms. Birkeland, from amongst many others from Public Health and other presenters. As we'll hear in the presentation, we really began the work on Tuesday night grounded in stories from people with personal experience, and then took that on to discuss a youth-informed approach wherein racial disproportionality became a key part of that discussion and reverberating theme over the following 2 nights, and the need to enforce existing laws. And with that, I'll leave it to the staff presentation and the summary that the panelists who are here to offer their insights.
Thank you, Board Member McDermott, and for those of you on the board who were able to attend one or both nights. And Miranda, then we'll have you introduce the panelists. Is that right?
I'll provide just a very brief overview given the hour of the 2 nights, and then hand things over to our panel to introduce themselves and provide comment. So with that, I'll get started as our panelists come to the table. Miranda Leskinen, council staff.
So Miranda, I'm sorry. So the people who are going to be presenting, you can come up to the table while Miranda's giving her overview. Thank you.
Thank you. So day 1 of the summit focused on community voices. After opening remarks by Board Member McDermott, the evening commenced with public testimony of personal stories from individuals and families impacted by gun violence, followed by 2 panel discussions. These panels entitled Robust Conversations regarding Youth Empowerment and Engagement with Community Members and Organizations Working Directly with Youth and Young Adults, as well as a discussion with healthcare professionals about impacts of firearm violence on public health and health systems. Day 2 of the summit, which focused on data and research for gun violence prevention, included 3 panel discussions, beginning with a discussion related to research and data approaches to reducing gun violence that included panelists from Public Health Seattle-King County, Harborview's Injury Prevention and Research Center, as well as the County Prosecuting Attorney's Office. This panel was followed by a discussion on firearms and suicide prevention with panelists from the Regional Domestic Violence Firearms Enforcement Unit, Vets Place Northwest, and Ashley McGirt Counseling Services. Day 2 of the summit concluded with a panel discussion around community next steps that included panelists from the Alliance for Gun Responsibility, Moms Demand Action Washington, Moms for Police Accountability, and the March for Our Lives Washington. With that, I'll conclude my remarks and turn things over to our panel of summit participants for introductions and comments on their reflections and takeaways from the summit. Thank you.
Thank you, Miranda. And before our panelists introduce themselves, just for the knowledge of our board members here, after we hear from them, then we're hopefully going to have just some discussion among ourselves on the board, if you have questions or comments and so forth. So thank you. Who would like to begin?
I'd like to start, if that's possible.
Great.
Thank you.
Thank you.
I just want to say thank you so much for having us here today, and special thanks to Councilmember Joe McDermott. I'm from the Alliance for Gun Responsibility Foundation. My name is Brandy Grant. I'm the programs director there. I want to thank the board for your continued help to prioritize gun violence prevention. You started this really important work back in 2016 by prioritizing the effective implementation of domestic violence protection orders and have continued to prioritize various aspects of gun violence prevention, including this week's summit on gun violence. I wanted to take a really quick second just to, make note of today is Nelson Mandela's birthday and some of the things that he stood for around service and the collective effort of working together to provide services to communities. And I felt like that sentiment alone reverberated throughout the two-day summit that we had with the amazing community members that stepped forth, not only to share their pain and some of the trauma that they've experienced losing their loved ones, but some of the amazing community members, therapists, organizations that are doing a lot of the groundwork to do prevention and intervention. So I want to start there as well, okay? The summit, to me and for most of us, really showcased that gun violence looks very different in every community within our county, and any effective gun violence prevention strategy that has to start by acknowledging the fact that ensuring that we include the right voices at the table when we're talking about gun violence prevention and the steps that we can take to make sure that communities are kept safe. It's really important that communities are involved in the decision and the policy-making process, and I feel like the two-day summit really highlighted the opportunity for us to begin to do a lot of that work. We know, for example, that in Washington State, a majority of the vast gun deaths that are suicides, but we also know that in King County, we see high rates of interpersonal gun violence, the kind of gun violence that disproportionately impacts Black and brown communities. Reducing interpersonal gun violence in our communities will take meaningful and consistent investment in community-based programs working to make sure that on-the-ground prevention intervention happens. We've looked at various models throughout the states, and we found that the Oakland model focuses on a few key components. It talks a lot about mapping data to identify most at-risk individuals, and it talks about engaging in respectful communication with them, connecting them to services, and narrowly focused law enforcement action. This is an example of a public health approach to gun violence that we could learn from here in King County. But we don't have to look to other cities for examples of what can work. We are lucky in King County to have many examples of organizations already doing so much important work already. And we've heard from many of them on Tuesday night, from community passageways to Choose 180 to Ambitions is Priceless to bridging of cultural gaps. There are many community-based organizations who have the knowledge and expertise to make a substantial difference in the levels of violence that we see, but they need to be meaningful backing. We have to have, and we need meaningful backing from our leaders. And we're looking to you, the Board of Health, and to many other city elected officials. Investing in community-based violence interruption programs not only helps us save lives by reducing gun violence, but it also addresses the trauma that is caused in communities that experience disproportionate levels of gun violence. The work of, and I'm kind of skipping around because I know we don't have a lot of time, but I really want to make sure that we make reference to the work of the Regional Domestic Violence Firearms Enforcement Unit that has done some really great work and set some great examples of how we do best practices in our county and the big impact on gun violence and serve as a model for implementation across the state. Some of the things that the summit highlighted were strong implementation of our state gun laws as a crucial aspect of preventing gun violence in our community. Passing stronger gun laws is only one piece of the puzzle. We also must commit to doing the work of implementing them. That is the most important part. The Board of Health can continue to lead by doing the following. We hope to see that centering of Black and brown voices are continued to be prioritized around programs that are addressing the interpersonal violence that disproportionately impacts community of color. We hope to see that there's a continuation to prioritize the effective implementation of gun laws in King County. This means increased investment in the risk-based work of the Regional Domestic Violence Firearms Enforcement Unit, a national model for ensuring that firearms are removed from the highest risk individuals and the highest risk situations of harm to self or others, and also that you use your influence to advocate for continued state investment in gun violence prevention research. Again, thank you for your leadership. The Alliance for Gun Responsibility looks forward to continued partnership with the Board of Health and with the partnership to reduce gun violence in our King County, Washington State, and as we continue to lead the nation across the country. Thank you.
Thank you very much for being here.
Thank you.
So I'm Ashley. Is this on? Thanks for inviting me. My name's Ashley McGirt. I have a private practice located here in Seattle on Beacon Hill, where I focus primarily on the impact of trauma and minority mental health concerns. So when it comes to the issues of gun violence, I really focus on the mental health aspect of that and how it's impacting not only the victims of gun violence, but bystanders and all of those who hear about gun violence on a day-to-day basis, which it's mainly people who look like me, because we know that African Americans are disproportionately impacted by gun violence. At least 95% of the African American community will experience gun violence. On just this Tuesday, I helped my fiance bury his baby brother who was found with a gunshot to the back of his head. A couple years ago at a Seattle public park, less than 20 feet away from me, I witnessed a man gunned down and killed right in front of me. And the most disturbing part, while I'm a trauma therapist and I'm built to handle this and I have the skills provided to help me heal from traumatic experiences, there were dozens of babies. None of the police officers, none of the firefighters, no one there offered any resources to these individuals, not to mention the restaurant across the street and everyone in there who heard the gunshot. Vicarious trauma is very real, and it has an impact on our body. It becomes stored in the body through somatic symptoms, which is also disproportionately killing Black people when we look at the rate of chronic illness from heart attacks, high blood pressure, stress, and all these other things that are killing us because we don't have the resources. So I would like the Board of Health to really make a commitment to partner with culturally competent therapists, Black and brown therapists in the community who really understand the concepts of minority mental health, who understand Black boy rage, which is a very real phenomenon where young Black boys lack coping skills, and so it becomes manifested through anger and rage, where they end up either harming themselves or others. The CDC still continues to report that suicide is the third leading cause of death for African American males ages 15 to 24. Yet there's no mental health services around. There's literally under 100 Black therapists in King County alone. I cannot serve this community by myself, but I can help educate and provide resources, but no one's reaching out to me. No one's reaching out to the community. I sat and I looked and I watched as this boy was literally murdered in front of all of us, and not anyone offered a hand or a resource, the crisis line. So still to this day, I don't know how those babies are coping with what they witnessed, because I know what I witnessed and the impact that it still has on me, and the impact that watching my boyfriend's baby brother be lowered into a casket from a gunshot to the back of the head, what that will have, and what each one of you will have as I'm just telling these stories. And you're hearing it today. People who look like me hear this every single day, and nothing's being done about it. And there's such a huge stigma around mental health, but we can bridge the gap by partnering with people who understand the impact that gun violence is having on the community and how minorities express their mental health, because mental illness it shows up differently through Black and brown individuals. So depression and anxiety for a white person doesn't look the same as it does for a Black person. And not all therapists are well equipped to understand this. The APA, the American Psychological Association, just a few years ago recognized the impact of racial trauma and what that's doing to our communities. But I really wanted you to focus on mental health and how all this trauma is stored in our body, and either we're dying from gun violence or we're dying from chronic illness that continues to kill us. So one of the solutions to gun violence is really going to be focusing on mental health and bridging the gap with mental health clinicians in the community who are doing this work, because I know all the Black therapists in King County, and not one of them have been reached out for any of this, of what's going on in the community, because I asked them, is the police force talking to you? What's happening? I'm hearing there's murders in Seattle all the time. What's happening? No one wants to talk to us, and the community doesn't know how to reach us, or they just don't want to because of the stigma associated with mental health in our communities. But we do our best to show up where our people are so that we can continue to advocate and make sure that there is a voice and that they do have a leg in a fight to stand on so that they don't have to die younger.
Right. Thank you very much, Ashley, for being here and for speaking last night
Thank you.
and the night before as well. Next, we have Ayanle Ismail.
Yes, thank you. Thank you for having me here. My name is Ayanle Ismail. I'm with Bridging Culture Gaps. It's an East African organization that got together to address some of the issues that we're having within the East African community. One of the reasons I would like to share is that when you think of the Black community, we like to put everyone in the same box, in the same category, saying this is a Black issue, but then also we don't get to the bottom of the problem, the root cause of the problem. What you're having here in King County is you're having a huge East African community that's about 30 years, that's been here about 30 years, and they come with an untreated trauma. So these folks are fleeing nations, civil war nations, from nation to nation coming here, and no one is treating them, no one is reaching out to them, and no one is making sure that this new immigrant community has the right resources. And one of the things that we have finally come to terms with is acknowledging that we have a problem within our community. We come from a culture that the family name means it's above anything. It's an honor. You cannot bring anything negative to the family name. So there's a stigma that if a child does something or a family member is struggling with mental illness, this brings shame to the family name. So we have not for about 25 to 30 years acknowledged or accepted our conditions in the community here in King County. So finally now we're seeing the results of not accepting these facts of suicidal thoughts, mental illness, untreated trauma from our parents that is passed on to generation. As many of you are aware, I'm one of the first African family that came in the 90s in the Yesla Terrace area, and many of you know the condition of Yesla Terrace and Rainier Vista back then. Some of the things that we dealt with, we didn't know how as an immigrant family that is already dealing with culture shock on top of fleeing in other nations, how to live in these communities. We felt that we would flee the civil war to come to another civil war in the neighborhoods that we got in. So now what you have is you're seeing a lot of gun violence within the African community. You're seeing a lot of mistrust, people not coming forward in terms of what's going on. So what we want to do is we want to make sure that when King County Public Health is doing these type of work, we want to see the outreach into the African community as well, because we are one community that's closed out from the rest of the communities. We don't want to admit that we are struggling, and these are American kids that are struggling, especially in the African community that are dealing with the gun violence. I want to commend Carissa and Dan for allowing us to work with our youth and giving us opportunity to do community-driven diversion programs. And so, but this is our first step to acknowledge the situation, what's going on in our community. So we're asking the policymakers, the decision makers, to do something about the situation in South End, in Tukwila, SeaTac, Kent. We are one of the third largest community when it comes to the Somali Americans. After Minnesota and Ohio, Seattle is the third largest. And so we are I'm talking about Somali, which is a small drop compared to the Oromo community, Eritrean community, Ethiopian community. When you think of East African, it's a huge group of people that are here together, and we are all dealing with similar situations. And like my sister here said, there are not enough therapists to deal with what's going on within our communities or counselors. I myself, dealing with these cases and gun violence and death every day within our community, I think I need therapists myself. I need someone that I can go to and say, that can relate to me and help me out deal with some of the things that I'm hearing as a father of four who's really worried about the generation to come. Yeah, so we're really we're in dire need of resources in our community. We're in dire need of allowing us to be at the decision-making table. We want to make sure that that we're not having discussion in closed doors that are not that are about us. So we want to make sure that the decision makers are including us in terms of those decisions. We do come from a culture that has support groups, but we do it in a way that you don't want other families to hear about the problems. So we want to kind of open up, but in order to do that, we need the resources in our community, and we need to address gun violence. Like my sister said here, I just heard last night, I was in a summit, but a young man committed a suicide and took his life and his family. And you will never hear these stories in mainstream media. And we want to make sure that our lives are valued, and we want to make sure that something is done. So I do appreciate the time that you guys have given us to speak to you, but we want to see action, and we want to make sure that there's follow-through after the summit, the 2-day summit. Thank you again.
Thank you, all three of you, for being here. Very appreciated. And I'm going to turn this meeting now over to Board Member McDermott, who will lead a discussion for our board members here. And perhaps there'll be some questions for you as well. Board Member McDermott.
Thank you very much, Board Member Colwells. Madam Chair, I would begin by opening it up for any other members of the Board of Health who were participating in the summit to offer their reflections and thoughts. And we'll move into questions of the panel and questions and dialogue amongst ourselves. Board Member Burney.
Thank you. First of all, I want to say thank you to all of you for coming today to sharing your stories yet again. I was there last night. I couldn't make it the first night, but it was a really powerful experience to have the opportunity to listen to your perspective on all of this. I think all of us bring our own personal perspectives, and I'm writing notes as you're talking, and the inclusion in the decisions and bringing in the voices from our communities. And as I left last night, I was talking with a friend of mine, and she was saying how we have to remember that certain communities might be more impacted by gun violence, but we can't take that as meaning those communities are gun violence. We have to really think about that there are communities trying to do like everyone else in King County and have better lives and get through their days, and they have this challenge before them, but that doesn't make them all of who they are. So I, as a Board of Health member and a member elected official in our community, want to do everything that we can to make sure that we are reducing the effects of gun violence throughout all of our communities and bringing in all your voices to us. This is just a start, and I hope that we continue with that and make sure that we are doing things to educate all of our public, everyone, and finding those resources to reduce the threat of gun violence for everywhere.
Thank you. Board Member Marks.
Thank you very much. Thank you for coming out to this as well. I think your time is incredibly important, and especially want to speak to Ayanle, what you mentioned in the youth empowerment panel, and again here today, and what the other members spoke to. I want to make sure that you know that we heard that it wasn't enough that we are going into communities or asking communities to come to us, but it's also empowering the work that's already being done, because the work that is being done within the community is working. It's just not elevated to the level that it needs to be. And I heard that, and that resonated really well with me. That was the message that I took home, as well as the importance for mental health. Ashley, for the comments that you made around trauma that extends through generations, especially in communities, and the need for culturally appropriate trauma care and mental health services. Having under 100 Black or Brown therapists in King County is unacceptable when that is the cultural needs that are not being met. So those are things that I will be committing to focusing on as we do talk about possible solutions, and I wanted to get that on the record and be very public about that. The other thing was the importance around suicide prevention. We did learn that over 93 suicide attempt with a gun is 93% effective. That was a terrifying statistic for me with to hear about that I wanted to share with the other board members here, that those who were unsuccessful in a suicide attempt, 80% or more of them do not reattempt. So when you have a 93% success rate with a suicide attempt by gun, they don't get that second chance. So things like this, if we're talking about preventing a public health crisis that surrounds gun violence, looking at the things that are the low-hanging fruit of suicide prevention, since that is the main cause of death around gun violence, and then also looking at culturally appropriate solutions in our communities that are working, and us coming alongside of those communities to helping to fund that and helping to empower that, I think is where our focus should be. And again, thank you so much for coming out.
You're welcome. Thank you.
Conversation.
Well, I'll just add one thing as well, in addition to what's been said. The other thing that I walked away from the 2 evenings was policies are only as useful as they are implemented and enforced and followed through with. There were a couple times where things were mentioned about things in place policy-wise, but yet there was no utilization or sort of education around those policies. So whatever comes of moving forward, that if we do consider policy interventions, that we make sure that there's supports to make sure that those policies are implemented, not just, pieces of paper, so to speak. So.
And specifically, we heard that about extreme risk protection orders and safe storage, that both are now law statewide, but need to educate about that and make sure people have the resources to take advantage of both have locking devices or storage devices and know of the availability of an extreme risk protection order, an ERPO, and how to go about achieving it, how to take that action. We heard that last year, 71 extreme risk protection orders were implemented. 69 were led by law enforcement, only 2 by family. Yet, when we started the evening, we heard about some people with lived experience. And in several of those stories, we heard about families who had some clue and weren't able to find resources or didn't know what to do.
Right, and as well as Dr. Rivara of the Harborview Injury Prevention Center talked about clinicians' roles in reporting things as well. So that's another thing, again, just as an example, to say there are things on the books that would be helpful, but yet there's no follow-through on some of these things. So,
Right.
Yep.
Board Member Bagshaw.
First, Councilmember McDermott, thank you so much for leading the charge on this. Obviously, this is something that matters deeply to all of us, and board members down there appreciate what you said. But I really wanted to direct my remarks to all of you. 2 things. The Washington Alliance for Gun Responsibility started the Saturday morning after Sandy Hook. And the fact that that alliance has built up so much credibility and that you were there and have been for the last however many years now is making a big difference. So I want to say thank you for that. Also, I am astonished and truly disappointed that nobody's ever reached out to you. So I want you to consider that before you leave, let me give you my cards. I want to reach out to you. I want to meet with you. I want to hear more about this, what we can do collectively, both as a city, a county, and as a region. So please don't leave without this. Thank you.
Madam Chair.
Thank you, Board Member McDermott. The stories that we heard, those of us who were there over the last 2 nights, were so incredibly poignant, but also very compelling. And I think most people who were there, if not everybody, left feeling a real urgency. But there's so much that we need to do. The state legislature passed an amazing amount of bills recently. There's been a lot accomplished, but I know Renee Hopkins said last night from the Alliance, implementation, implementation, implementation. So we have to make sure that's done. But here at the Board of Health, the City of Seattle, our other suburban cities, the King County itself, what do you 3 see is the most urgent approach that we can take? What do you advise us that is most important for us to take action on for something that's not concerning implementation?
I think it would be really good to hear from Ayanle on it, but I want to say from a systems standpoint, work for funding and capacity. You all had the opportunity to hear again from some remarkable organizations that most times are only ran by 5 to 13 people on any given day. And a lot of that is volunteer-based. I would probably say 70% of that is volunteer-based. So having the opportunities for organizations to have the funding and resources they need to be able to hire within those said communities that are impacted for that real-life experiential piece that they're able to give to the young people that they're serving, I think is really important. I would have to say funding. I really would. Funding and support. And you know, it's one thing to hear from people, but to collectively work with them to make sure that once you've heard it, then what are the next steps? But I would say funding. I would say funding and capacity building.
I second that, and I also say funding because while I talk a lot about mental health cost, and not everyone has the ability to afford mental health services. I provide free services to hundreds of individuals yearly, and I'm only one person, and I'm also running a business, so I can't continue to sustain, but I do offer free reduced sliding scale rates. But if there was funding available to victims of gun violence, bystanders, so that they can seek treatment, because that's the number one deterrent around mental health. Once you get past the stigma, it's like, well, how am I going to pay for this service? I don't have insurance, or my insurance doesn't cover you, or you don't take insurance. So how can I get the funding to get the help that I'm actually ready at this point to receive? So definitely funding, and education. A lot of education around the impact of mental health and how it impacts different races on a different basis, because as I mentioned, depression and anxiety looks very different for a Black boy than it does for a white boy. Hispanic and every other person, it shows up differently.
On my end, there's already diversion programs that we have with the East African community, which is done solely by volunteerism. So just funding what's already in place with the King County courts that we've already developed a relationship with, and also with making sure that we have this issue, but at the same time, we're dealing with double sword in our community. There's the gun violence, and then if we try to get folks to give up their guns and create a safe way of re-educating the community, that there's no backlash, or there's no, especially with the felony cases, we want to make sure our kids get opportunity to start life all over and get a second chance in life. So I know there are programs within King County, but we are voluntarily doing these programs for the last couple of years. So we're hoping that we get the funds. That'll be, that would really definitely help us to get, more awareness and get the parents on board, create more trust building opportunities amongst institutions and the community. So at the end of the day, it does fall back on funding, but at the same time, let's look at the programs that are working, that's already in place, and how we can fund those programs to even create a bigger capacity for the work that we're doing.
Board Member Honda?
Thank you. Thank you, and thank you for being here today. I wasn't able to attend the summit, but was it taped? Did I read that it was going to be taped and shown later on Channel 22?
I believe the Alliance filmed all of the content.
Okay. So it'll be shown somewhere?
I'll check and make sure
Okay.
the board knows.
Okay, that'd
Yeah.
be great. My question is, what are the schools doing? We have, they have students in school with them 6 hours or so a day. And how are they reaching out and trying to work with gun violence? Do they have a program that's pretty consistent across King County?
I'm in Tukwila School District, Foster and Showalter. Our focus is dealing with how to deal with conflict for Black and brown students, and also we're working towards addressing punishment and discipline at the school level, high school and the middle school. So our focus is more towards the school to prison pipeline, tackling that issue, and also we do have the Best Start for Kids Trauma grant that give us the opportunity to engage our parents and the students. And so gun violence is not addressed at the school level. I haven't seen any programs or any implementation, but that would be something, because we've seen as young as middle schoolers carrying guns in the neighborhood. So the issue, it looks like it's going to get worse and worse if we're not having the discussion now or adding a curriculum that talks about gun violence in our communities.
Thank you.
I know the Alliance, we've worked really hard to try to get in the school systems, and a lot of the relationships that we have currently with schools, they're based on personal relationships or us working with the Washington State PTSA. It's a really difficult conversation to have, as real as it should be, and it should be happening. There is some strain and level of uncomfort when you're approaching schools about coming in and talking about gun violence awareness and gun violence prevention. So on that end, I would even bring that question back to you, Mayor Honda, about the possibility of, working together to figure out a way to have schools be more open to, because the resource and curriculum is there, but it's bridging that relationship so schools and parents and families want to work with us to do that type of work inside of the schools, because I think that's really important. The vast majority of our young people's time is spent at school, and that's where the majority of them feel unsafe, ironically enough.
I think one thing that was striking for me was that when I was identifying throughout the 2 evenings of action to take, it wasn't the key takeaways for me were not new laws, new ordinances, new policies that needed to be created and implemented. Instead, it was education and implementation of existing policies or funding existing work, either expanding it or continuing it so that it continues to work. From expanding culturally appropriate therapy and its availability throughout our communities to continued funding for the Shots Fired report. And while it didn't come up specifically, I know that the Harborview Injury Prevention Center works annually to ensure its ongoing base funding. So a big takeaway for me was not that any of that was new, but the intense value of making sure that we do well what we're doing now or have started to do and expand and implement it well. And again, something that I knew something of, but really came home to me over the last 2 nights was how important it is that we recognize institutional racism and its impact in gun violence and how it impacts communities of color and how much we have to do to be involved in those communities, supportive, and not from our entities, but supporting the existing community-based organizations that are already doing that work, expanding their capacity and making sure that it's culturally competent as that work is being done. It's a key piece that, in my understanding, is new work, is to expand exponentially how much support we might be directing in those areas now. We've begun that work with Zero Youth Detention, with some of the work through Best Starts for Kids. But I think if we heard anything over the last 2 nights, we've heard how much exponentially that body of work, in my understanding, needs to be expanded. Dr. DeLucky, did you have your hand up?
Well, one of my thoughts is working with education and dental education and trying to increase minority students in that area. Really would like your insights on how to increase more therapists that look like you.
Yeah.
I have no ideas in that area. I certainly see the issue in multiple areas of healthcare.
Definitely reaching out to us. I speak in schools quite a bit, but I've noticed that it's often reactionary. Something occurred, someone was shot, a major incident in the school system occurred, and then they invite me to speak. It's never really preventative. And when I'm there, everyone's like, oh, you're the first Black therapist I've ever seen. No one's explained it to me in a way that I could receive it that's culturally relative to where the students get it and they can process it and they have the skills and the tools to work, then what happens is everyone in the school, when I'm there, hundreds of students want to be seen by me, and I don't have the capacity to see hundreds of students. But what I do is I encourage them to go down my path so that they can study psychology, and I explain the process. So I'm really a face so that they know what it's like, so that we can have more minority mental health therapists in the field. But really just paying attention to what's happening. I went to Foster High School when Nipsey Hussle was murdered, and none of the teachers were speaking to the kids. They didn't realize the impact of this American rapper's death on them, and these students were grieving. While they didn't know Nipsey Hussle, it still had an impact on them, just like the loss of Tupac for many black individuals when he died in the 90s. So the Nipsey Hussle is the Tupac of this generation, and nobody was talking to the students about how they felt. Meanwhile, they're extremely depressed and sad, and I was the first person who sat down and had a conversation about the death of Nipsey Hussle and the impact, and they began telling me more names and more names of individuals that they knew. Meanwhile, these kids are freshmen, and they're naming a dozen people who've died to the hands of gun violence in high school. And nobody sat there to talk about it with them. But it was definitely a profound conversation, so I think just more of that, inviting more of us to the schools, and ahead of time before something happens, and being aware and knowing, hey, this, someone like Nipsey Hussle just happened, let's talk to our students and see how it's impacting them, as opposed to saying nothing.
Councilmember Marks?
Thank you. One other thing that I forgot that I thought was really impactful that I took away from the summit was also talking about the kind of the contagion theory around gun violence. So it doesn't just impact the person that it happens to. And Ashley, I think you talked on this really well specifically. But when someone witnesses the gun violence there, it came out of the shots fired report as well. It spreads out into the community or those that are surrounding. So when we're talking about possible solutions, I would love to see us talking about ways to provide police that respond to a shooting at a park with guidelines that say that they will also talk about ERPOs, the extreme risk protection orders, to people that are there, so that if those that were witnessing gun violence are now, we know that they're more at risk to then experience it themselves further down the road. Now they know of this resource that's out there. So it's at least in the back of their head. So they have this touch that's happened at least one time while it's there and fresh in their minds. And extending that into the schools, as Board Member Honda's question was there, we are talking about gun violence as a public health issue. The former Surgeon General talked about, if it's not a public health issue, why are people dying from it? That was a quote that we heard last night, and that's a really poignant quote that we need to take with us. We have the cover of public health to talk about it in our schools, which it is a really difficult relationship to build. So I would like to see us find the different really low-hanging, low-cost ways for us to have that initial immediate touch in communities when there are gun violence responses that are happening. How can we get information out immediately?
Dr. Daniel?
I won't restate everything that people have said, but I think as I listened to the very powerful panel discussions last night and the informative evidence presentations, I kept thinking, what is it that the Board of Health can do and will do? And the one thing I was really encouraged about was that there seemed to be many things that were actionable. There seemed to be things that would be particularly actionable if they're approached. If you amplify the approach by thinking of it as a public health problem, but I think there's still the next tangible step of how do we put that into action. And I haven't heard yet, and I'm kind of deferring to the people who've initiated this and chair the board, and is that how do we take these ideas and thoughts and voices that have been brought, to this public forum into potentially tangible policy statements or actions. I mean, should we have a committee? I don't see this happening, on a monthly meeting basis, for example. And are we going to count on the elected officials going back to their respective bodies and pulling this together? Or is the Board of Health going to take a continued but expanded active role in this area?
Madam Chair, may I?
Yes, and then we will have to move on.
Thank you. I didn't expect we would come out of the summit over the last 2 nights and today's conversation with a concrete list of our next steps and who is going to accomplish it. But I knew we would have a robust conversation about what work needs to be done. And I commit, with the board chair and others, to continue this work, indeed between meetings, not just at a monthly Board of Health meeting, but engaging with the communities that we heard from that strongly expressed the need that if we're going to do this effectively, to be out engaging with them and to make sure that we're implementing. The key part, again, that I heard was to make sure that we're educating and implementing for policies and laws that are in place today and funding existing work, and then some new policy as well. So I hear a broad piece of work that some is to be led by the county council, that some various city officials who participated and sit here would be able to take back and work, and that us as a Board of Health can certainly be engaging with hospitals about making sure that trauma-informed therapists are available to people who have been victims of gunfire, because they are more likely to again be victims. So a continuing body of work, and expect and look for action items here at the board in the coming months and in briefings and work between meetings as well.
Thank you, Board Member McDermott.